Hello, welcome to Local Edition. I'm Leslie Leyton. We're here with Senator John Moorlach talking about some of the pressing issues in Sacramento this session. One of them having to do with health care. You're on a committee looking at that throughout the state. Tell us how the work is going on that.
Well, we have two special sessions, one for transportation and one for managed care organizations, developmental centers. I get to sit on the second, which is a real interesting opportunity. I served on the CalOptima board for 4 years, so I certainly understand a lot of the Medi-Cal issues facing California. Also with the ACA, the Affordable Care Act, there's just a lot of movement. So the governor balanced his budget for this year, but he didn't include $1 billion for the MCO, the Managed Care Organization tax. So we have to figure out how to find that money and tax all these organizations like Kaiser Permanente, Aetna, CalOptima, everyone that's handling healthcare throughout the state. So
when these important funding issues are left out of the main budget, then they get special attention outside of the main budget and potentially additional taxes for the rest of us. And you guys are looking at how to manage this and who's going to be taxed and how and what's going to be covered.
Right, now very perceptive. It's sort of like, let's put a budget together so we abide by Prop 25, which said that if you don't finish the budget by the end of June 30, then you don't get any pay. And so everybody's like putting the budget together, and then the governor says, okay, I still have these loose ends. So the federal government will match our tax and provide more money for healthcare, but it means that every managed care organization has to pay the tax, not just those that are doing Medi-Cal work and getting a match. So we've got firms like Aetna, which will see a $74 million spike in their taxes. So that they even have a list, winners, losers, which MCOs will benefit, which will fall behind. So the medical industry is just going bonkers right now. And what's nice about a special session is it could call a meeting anytime. So I'm sort of at call. I could get a note tomorrow saying, hey, be in Sacramento on Monday for a day-long session. So the issue is we're coming closer to an answer. They want to do a tiered structure. I gave some input in one of our committee meetings, and so we're working with the industry, but there's not a simple, clean fix, but it will have an impact on your insurance premiums,
what I want to know. What does this mean? And this could be extra stress. For the benefit of potentially additional health care, we have extra stress on businesses, healthcare providers, but what effect does it have on us, the regular peeps out there trying to get along in our normal day?
Well, for a large provider, it's about $1 per member. For those with 200,000 members or so, it's $14 a member. So all of a sudden you would see your costs go up, you would see your premiums go up. So it won't be borne by these managed care organizations. They don't have the reserves to suck that up for a long period of time. It could even impact the doctors that are providing the services. We're already giving very reduced rates to doctors for doing Medicare and Medi-Cal work.
And a lot of patients are seeing reduced rates on their health insurance because it's subsidized also by incentives from the government as well. So taxes potentially go up for everybody too.
Federal and state. Yeah, great life.
Well, it's a lofty issue. There's a great need for focus on health care, but it's good to hear from you what you're talking about in these sessions and what effect it might have. Keep us posted.
Thank you, Leslie.
Okay, thank you very much, Senator John Moorlach, for being here. Thank you for joining us, too. I'm Leslie Leyton.